The government has set aside 32.4 billion ringgit for the Health Ministry in Budget 2022, a 1.5% increase compared to last year. Health experts are saying the amount is inadequate. The Malaysian Health Coalition is calling for the government to spend more in healthcare to better fight COVID-19, other chronic diseases, and to prepare for future pandemics.
Expenditure for health has always hovered about 4% from our GDP. However, if we compare this with developed nations, like say the OECD countries and all, they have, of course, a very high income. This is why they are called the high-income countries, but their GDP to health is about 8 to 10%. Of course, in certain countries, let's say US, of course, it may not be the best example, but they go up to about 18%. So if you look at middle-income countries, most of us will look at around, 4%, 5%, but some of the advocates, example from WHO, say that you should actually your expenses should be around 5 to 6% of the GDP of a country. So if you compare with Malaysia, we are actually very far behind. So in that sense, we still say that this is inadequate, an increment of about 1.5%. We thank the government for the increment, but we still say that this is slightly inadequate.
Dr. Sharifah said additional allocation should be channeled to the public health services managing non-COVID-19 care, such as those treating non-communicable diseases.
Health centers and health clinic, the public health sectors or services are the most cost-effective service that's available. So you need to strengthen that, especially when we have just faced a very big pandemic, COVID pandemic, and we don't know what other pandemics is going on. At the moment, we already have two pandemics, so-called the infectious pandemic, which is COVID, and we also have the non-infectious. And this is where our non-communicable diseases are basically a big portion of our budget are actually trying to, fight our non-communicable diseases, or what we call as NCDs. So this will include like hypertension, diabetes, stroke, heart diseases, mental health problems, and so on. So these are things that we need to strengthen. So we don't have enough budget devoted to that.
She also emphasized the need to strengthen healthcare resources and programs to prepare Malaysia for future pandemics.
The healthcare staff in the public health centers, clinics, and so on. Our healthcare programs are not very are strong, but they are not manned enough by public health experts, epidemiologists, virologists, and things like that. So these are things that we need to strengthen facing the future pandemics that might occur.